Hi, this is Dr. F.J. Schofield with Rhino Management, Mochichu, the Schofield Chiropractic Training. You can go to mochichu.com for the most advanced communication techniques and management group information. I've now been practicing with Dr. Fred Schofield for almost a year and have learned an immense amount. And one of the biggest things I would say Dr. Fred has hammered into me is you've got to find the patient's objection on the consultation. After that consultation, the patient should only have 3 questions left. Can you help me? How long? How much? So you got to get rid of all other questions about chiropractic in the consultation. And you want to have on your patient history form a spot that says, have they been to a chiropractor before or not? So you know going in, all right, this patient has never been to a chiropractor, so a key question you must ask them is, what have you heard about chiropractic, good and bad? Because there's a lot of information out there that's just not true that people have heard. So you want to dig and dig and dig. And sometimes you got to ask them a few questions. Some people are hesitant, like they're going to offend you by telling you what they've heard. Common things are you have to go forever, it hurts. Those are probably the most common. And you want to be ready for those and have quality responses so you can educate the patient. In our office, we do specific corrective care, so you don't have to go forever. If we can help you, there'll be a beginning and end point to your care, just like when you wear braces. When the teeth are straight, the braces come off. When we achieve maximum correction of your subluxations, then the corrective care ends. After that, if you want to do prevention, that's up to you. Okay, if they say it hurts, we've studied many different techniques, so we have extremely gentle techniques that have no audibles. That's another one. I don't want any popping or cracking noises. We've studied techniques that have no audibles, so that's not a problem. They're extremely gentle. You won't even hardly feel it. SOT is a great technique. You can go to look Rhino SOT, and I go over some of the basics of that. Very, very gentle. A lot of people really enjoy that. Causes strokes. I heard that one about a week or 2 ago. And I just told them, well, the old research said that you were more likely to get struck by lightning, but the newest research shows there's actually no correlation between the adjustment and the stroke. And after that, he was ready. He wanted to get, he wanted to get out of pain. He wanted to correct his subluxations. So you got to find that information. If they have been to a chiropractor before, why are they making the change? Have they moved? What did the other chiropractor do? You want to find out all of that information. So one thing you must ask them is, how was your chiropractic experience, good and bad? What were the positives? What were the negatives? We've had a lot of people, well, the chiropractor laid me face up, he twisted my neck 2 ways, and I felt worse. Okay, well, we won't be doing that in this office. So make sure you know many techniques, because everyone responds differently to different techniques, and we have over 10 different techniques we can use to adjust the patient. So you want to find that out. Find out what techniques the other chiropractor used, how long did they go. You can get into the finances if you like. He was charging me $70 a visit. Okay, well, we're much more affordable than that because we want to help the people that are committed to getting healthy. So you want to find out all that information. What did they like? That's also good information. And he laid me face up. He put his hand on my back and he kind of like laid on me, and it felt great. I loved it. Okay, well, I am trained in that technique as well. We can definitely do that. So you want to get all that information before you go into the exam, before you go into the report of findings. Because if you haven't covered that, you go into the report of findings, your understanding of where they're at and their understanding is going to be off. They might have gone to a chiropractor in the past, had 2 adjustments, and thought he corrected it. Well, no, you got out of pain. The effect was gone, but the cause was still there. That's why you're back in here. So you got to cover that, or else you're going to the report of findings thinking, well, this is going to take, 6 to 24 months to correct, possibly, maybe less, maybe 3 months, and they're thinking it's going to take 2 visits. So you're understanding there are 2 different levels. So you've got to dig that information. If you're a very busy office, you can train your CA to do that, but you've got to make sure to get all that information out so you guys have the same understanding going in the report of findings. One thing we put on our consultation form, we've updated it. Any of the one-on-ones, you can call and get this form, but put on chiropractic understanding experience, good and bad. You want to have that to remind you, because if you're seeing 20, 25 patients in an hour and then you got to do a consultation, you're moving and grooving, you got to make sure you cover these very, very important elements. There's a lot of fundamentals to the consultation and all the visits in the office, But that's one very, very important. Find the objection and educate the patient. Tell them the truth. For all other, you can go to our mochichu.com, mochihchu.com, or call 1-800-554-3260. Dr. Fred has many CDs that go over all this information and DVDs about the consultation, the reported findings, the daily visit, all educating you to really, you want to master communicating chiropractic to people. Your ability to communicate, or your quality of communication, will determine the quality of your practice. Have a great day.